Bismillahirrahmanirrahim. So today we are going to study about the leukoplakia. So what is leukoplakia? It is a pre-malignant condition and it can be defined by the WHO as any white patch or plague that has the following three features. Number one, that it can't be scraped off. It cannot be scraped off. The second one, that it is not due to any other clinical or pathological disease. It cannot be easily scraped off. It is not due to any other clinical or pathological reasons. And the third one, it is greater than the 5 millimeter in diameter. When these three characteristics are present and the lesion is wide, then this can be characterized as this can be diagnosed as the leukoplakia. The first one, it cannot be scraped off. The second one, it is not due to any other clinical or pathological reasons, i.e. all other diseases are excluded. And the third one, that the size of this lesion must be greater than 5 millimeter. Then this can be diagnosed as leukoplakia. Now the important point is that this leukoplakia must be distinguished from the oral thrush, which is due to the Candida albicans, and the white lesion on the tongue or in the mouth can be easily scraped off. This can easily be scraped off. And the other example of white lesion is the hairy leukoplakia. In which there is also a white lesion, but this hairy leukoplakia is mainly due to the immunocompromisation of the patient and is much more related to the AIDS and is caused mostly by the Epstein-Barr virus, which cause hyperplasia of the lateral side of the tongue, and we can see it as a white lesion. Now, talking about the incidence of the leukoplakia, so it occurs in about 3% of the whole population. In about 3% of the whole population, in this 3%, about 15 to 30% develops into a carcinoma. In these 3%, about 15 to 30% develops into a carcinoma. Now, what are the most common sites for the leukoplakia? So, the most common site is the floor of the mouth. The second most common site is the palate, which is both hard and soft palate. The third one is the lip, and then the tongue. Can also involve the other regions of the oral cavity like the gingiva, etc. Now, what are the main risk factors? The main risk factors for the leukoplakia are the tobacco, both in the chewing palm and the smoking palm. The other risk factor is the chronic use of alcohol. These both causes irritation of the oral mucosa, and this can in turn develop into leukoplakia. The third risk factor is the chronic trauma, and this chronic trauma mainly occurs due to the abnormal or the defective denture, or it may be due to chronic or poor use of the hot and spicy foods, etc. Now, talking about the morphology, so grossly we can see the leukoplakia is white or whitish yellow patches, as I have already discussed, but they are well circumscribed. And they are slightly elevated lesion. The first one, they are whitish or whitish yellow, they are well circumscribed, and the third one, that they are slightly elevated. So here you can see this white patches or white lesion, and this is leukoplakia. Now, talking about the microscopic features, and it occurs mainly in two palms. This leukoplakia occurs mainly in the two palms, the hyperkeratotic type and the dysplastic type. In hyperkeratotic type, what occurs? There is hyperplasia of the squamous epithelium of the oral cavity. And the second one is there is hyperkeratosis. Hyperkeratosis on the surface of this squamous epithelium. Now, what is hyperkeratosis? This is increase in the concentration of keratin on the surface epithelium, and is mainly due to the keratinocytes. Now, what occurs in the dysplastic type, that the cells of the epithelium show the features of dysplasia. Now, what are the features of dysplasia? So, the features of dysplasia are, for example, like abnormal or increase mitotic figures. Second one is the pleomorphism. The third one is the hyperchromatism. And the fourth one is the irregular stratification of epithelium. Irregular stratification of the epithelium. Keep in mind, this is an important point, that in this dysplastic type there is irregular stratification of the epithelium, but in the hyperkeratotic type there is regular and orderly hyperplasia of the squamous epithelium. This is very important point. There is regular and orderly hyperplasia of the squamous epithelium, where in the dysplastic form there is irregular stratification of the epithelium. Also, we can see in the dysplastic type that there is inflammatory infiltrates into the submucosa. Now, when this dysplastic type is much more severe, in the atypia in the epithelium is much more or increased, then this is known as erythroplakia. Erythro because it can be seen as red velvety due to its vascularization. It can be seen as red velvety due to its vascularization, and the atypia and the dysplasia is much more pronounced than the dysplastic type. And this erythroplakia has much more increased chances of developing into the malignancy. Now, when this epithelial atypia involves the whole thickness of the epithelium but does not cross the basement membrane, it is called carcinoma in situ. Now, these are the slides showing the leukoplakia. This is the hyperkeratotic form, and this is the dysplastic form of the leukoplakia. In the hyperkeratotic form, here you can see the hyperkeratosis. This is the hyperkeratosis in which keratins are present, and underlying the hyperkeratosis, here you can see the stratified orderly arrangement of the squamous epithelium. The whole is the orderly arrangement of the squamous epithelium, and also here you can see that the basement membrane is intact. The whole basement membrane is intact. In contrast to the hyperkeratotic form, in the dysplastic form, you can see the cells in which there are dysplastic feature, like the pleomorphism, in which some cells are large and some cells are small. The hyperchromatism shown by the dark nucleus. You can also see that there is no intact basement membrane. So that's all for today. Thank you.